And so when my mom pointed that mole out on my chest, I knew it was a mole that I had for quite some time. Do you wear sunscreen? No. Have you used tanning beds? Yes. Have you had many sunburns? Yes. And then they looked at me head to toe, and the only mole that they were concerned about was that one on my chest, the one that my mom pointed out. And she said, unfortunately, your results came back, and the mole we removed was stage 1A bordering stage 1B melanoma. I went online on social media, and I started searching like hashtag melanoma, hashtag, skin cancer.
Welcome to Derm-It Trotter. Don't swear about skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter Don't Swear About Skincare podcast. Today we're going to take a little different step on how we've really talked about everything skin so far. As you know, we've included experts on everything skin to bring you new information about what's going on. But now we want to talk and shift gears about maybe what's happening with patients, because I think that's something that gets neglected or not really thought about. So I've got a special guest here with us today to really talk about the patient perspective and her struggle in particular with melanoma. I have Leah Adams on the show with us here today. She is a melanoma survivor, an avid runner, and the daughter of a melanoma warrior. She's come with us today to really share her perspective and remind us of the human side of what it means to actually have a skin condition, in particular skin cancer or melanoma, which is timely for this month. And then also for those of you out there to let you know you're not alone. There are others that have experienced maybe what you're going through or another family member. So Leah, I'd like to welcome you to the podcast. Thanks so much for coming on today.
Thank you so much, Dr. Trotter, for having me. I'm so excited to have this conversation with you today.
Well, it's really nice of you to come out and share your story. I know it's not your first time, doing this. You've really made this your work's life and passion, which I want to thank you for, because not everyone feels comfortable, opening up their personal life to the public. And so I thank you for coming on and talking with our listeners today. And what I wanted to start, obviously, at the beginning, do you mind kind of telling us about how you were diagnosed with melanoma and kind of just a little bit about your story?
Absolutely. So this really takes us back to 2019. Probably in the late summer, early fall. My mom pointed out a suspicious mole that was on my chest, and she noticed it because she was accustomed to what funky moles looked like, because my mom actually found my dad's melanoma on his upper back a month before she found my mole on my chest.
Go mom, go mom.
Yeah. Exactly, right? Thank God for moms. And so she realized, after experiencing that with my dad, she knew what to look for as far as irregular, abnormal looking moles. And while my mole was different than my dad's, my mole on my chest did not look right. It was multicolored, had uneven borders and edges. And my mom also knew at the time I was actively using tanning beds and laying out in the sun. And that really kind of was my life for quite some time prior to 2019. I live in Ohio, where we don't always see the sun all the time, all year round. And let's be honest, we really take advantage of the sun while it's out in this state. And I know you can understand that, Dr. Trotter, being in the wonderful state of Ohio. So, I think my first session in a tanning bed, I think I was 17 years old. My mom had to sign off for me. And then when I went to college, it was kind of like a free-for-all. I did whatever I wanted to do. I was 18 and I used tanning beds in college, used them in grad school, used them after grad school. And something that I wasn't really super aware of was the cumulative damage I was doing to my skin time after time. And another thing I didn't really realize were my risk factors for skin cancer and melanoma. My dad's dad had a handful of squamous cell carcinoma, basal cell carcinoma. My dad, had a melanoma. So another thing too was, in order for me to get tan, I really had to burn first. And then I would kind of achieve that tan. And that was like every single summer for as long as I could remember. And the tanning that I was doing prior to my melanoma diagnosis, it truly became an addiction. I was doing it at one point in time almost every day.
Mm-hmm.
And I did it because I liked how it felt. I liked the warmth on my skin. I liked how I looked. I thought I looked more attractive or beautiful while I was tan. And what was nice about tanning beds is you had the option of, not tanning with anything on, and you didn't have tan lines, and you didn't have to worry about the spray tan, being sticky or smelly or anything like that. So just to kind of give you a background of kind of where my head was at and why I behaved the way I did when it came to sun safety, which was not safe at all prior to melanoma. And so when my mom pointed that mole out on my chest, I knew it was a mole that I had for quite some time. I don't remember how long, but it was a while. And she said, you just saw what happened with your dad. You should probably go get that checked out at a dermatologist. And, back then I was 26 and, I was still in the process of moving out of my parents' house after grad school and kind of still having that like 20-year-old mentality of like, yeah, it's fine. It's no big deal. But it never got out of my head. So I went down the Google rabbit hole, which nobody ever should. And I was Googling photos of skin cancer and melanoma and, trying to convince myself that, what I had was fine. And if anything, it was just precancerous. And so I just came to a point where I was like, you know what, I'll just make an appointment. So I did. And I went in for my first skin check ever at the end of September of 2019. And, it was a very interesting experience. I don't think you're always prepared for what a full body skin check is. And even, before they even did the exam, they were asking me questions that I was answering them in a way that they were, I think, not a fan of. Do you wear sunscreen? No. Have you used tanning beds? Yes. Have you had many sunburns? Yes. And then they looked at me head to toe, and the only mole that they were concerned about was that one on my chest, the one that my mom pointed out. And they biopsied it. They wanted to send it off. And they said I'd get the results in, I think they said 3 to 5 business days. So after that appointment, I wasn't too concerned because, again, I just was convincing myself, oh, it'll be nothing. I'm too young to have skin cancer or melanoma. This is not going to happen. Talked to some girlfriends about it afterwards, and they said, oh, yeah, I've had precancerous stuff. You just kind of freeze it off and move on. And then we were past the 5 days, and we were going on 7 business days. And then I started getting worried, and I called my dermatologist office and they said, we had to do some additional testing on your mole because it was so atypical looking that we had to do some additional staining. And I was like, that doesn't sound good, but okay, we'll keep waiting. And it was on the 14th business day, I finally got the call. And I knew the second I heard my dermatologist's voice, it wasn't going to be good news. And she said, unfortunately, your results came back.
Mm-hmm.
And the mole we removed was stage 1A bordering stage 1B melanoma. And the very first thought was, oh my gosh, this is worse than what my dad's melanoma was a month before because he had stage 0 in situ. And because of my bordering stages, my dermatologist had like immediate upcoming like next steps that she wanted me to do. So the first priority was getting me in for surgery to get the melanoma removed off my chest. Then she wanted to do a sentinel lymph node biopsy to see if the melanoma spread to my local organs or lymph nodes, knowing my, risk factors for skin cancer. And this was all just a lot to take in less than a 10-minute phone call. And they got me in for surgery about 2 weeks later. And again, that was another thing I wasn't prepared for. They called it an outpatient procedure, but I was put under anesthesia. I was basically in that hospital for like 8 hours, from prep all the way till, I was cleared to go. And, it's so funny. There's that stigma around you can just get, skin cancer cut out and moved on. And one of the questions that I asked when I woke up from surgery was, when can I run again? Because as you mentioned in my bio, I'm a runner. And, my mentality was like, okay, like, let's get back to regular scheduled programming. You got what you needed. Now I need to get back to kind of my life. And they were telling me I wasn't going to be able to run for a while because I was at risk of lymphedema with the lymph nodes being removed, popping a stitch, infections. And they showed me what my chest and what my underarm looked like with the sentinel lymph node biopsy. And man, they take a lot more than you think they take. And, I think that's kind of when the reality set in and healing afterwards, and knowing that I was still waiting on results after surgery because I didn't get the results from the sentinel lymph node biopsy right away. And so I kind of was in a mode of, depression after that. Honestly, it just was a lot to grapple with. I felt anger and fear and, confusion and sadness and embarrassment because I felt, Dr. Trotter, I gave myself cancer because of everything that I was doing up until that moment.
Yeah.
And, luckily, I think it was like 2.5, 3 weeks after surgery, I got the results from my sentinel lymph node biopsy that, it did not spread to my organs, the melanoma or my lymph nodes. And, I was really considered one of, the lucky ones because I know that that's not everybody's story when it comes to melanoma, because as I found out going through this experience, melanoma is the fastest spreading, deadliest type of skin cancer. And, I felt extremely grateful for that. And it's still, looking back almost 6 years later, it didn't hit me in that moment, but I started to really understand it, like as the days were going on. And so once I kind of got that clear, I felt like called to kind of share my story. One, because I didn't tell anybody this was going on. The only people that knew was my boyfriend at the time, now fiance, my parents, and maybe a couple of friends, and my colleagues, because I had to be out for some appointments. But I truly was scared to tell people because I had this kind of imposter syndrome, like, oh, if I tell people that I had melanoma, they're going to say, well, you should have known, using tanning beds, like you did that to yourself, like really getting in my head about it. And I went online on social media and I started searching like hashtag melanoma, hashtag, skin cancer. And, before I did that, I felt like I was the only 26-year-old in the world that would understand what melanoma was and what skin cancer was. And then, searching that online, boy, like, was I wrong? There were hundreds and thousands of women my age or even younger or a little bit older sharing their story. And I was just really like inspired by that because it made me feel less alone. And that's what I was looking for because, the last, couple of weeks of healing from melanoma, I felt very isolated. Running, which was a therapy and still is for me, was taken away from me. I had a lot of restrictions of what I couldn't do. And I couldn't even lift, I think, more than like 10 pounds because of, my incisions. And so when I saw that on social media, I kind of drafted up a caption. I had a picture of my, incision. And then I posted about it on social media. And at the time, my account was private. So only my family and friends or current followers saw it. And I was nervous. I remember posting it and I threw my phone on my bed. I was like, oop, I don't know what's going to happen. And I was very pleasantly surprised that, I received a lot of love and support and people thanking me, for sharing my story. And I even found out some people in my circle had melanoma that I had no idea. And I think that was really the start of, from now or from then until now, kind of where my journey has taken me and really how I felt inspired and empowered to share something that was really hard for me to go through, was an opportunity for me to teach others and share with others my story. So nobody hopefully would have to go through what I went through when it comes to melanoma.
So take me back, when you get diagnosed, you're 26 years old and you hear, literally that you have cancer. I can't imagine, anyone ever dealing with that diagnosis. But when you're 26, like you said, graduate, you have the world ahead of you, what goes through your head? I mean, did you really think like, oh my gosh, I could die? Like this is serious. And like what goes through your head at the moment? I know you talked about being a little overwhelmed with that, but what really goes through your head? And how would you tell somebody that might be getting a similar diagnosis, like how to process that? And I know that can be different for everyone, but how would you try to give them a little bit of insight or advice on that as well?
I never thought that at 26 I would hear those words that I had stage 1 cancer of any type. Um, like I mentioned, there were a lot of mixed emotions and feelings. And one of the most vivid things that I remember, and I've said this before when people ask me about my story, is kind of felt like my world went from color to black and white, or one of those scenes in a movie where something happens to the main character and they're moving in slow motion, or the people around them are moving in slow motion and you're the only one moving like at normal speed, or vice versa. It's like a surreal feeling. And it's for somebody that may be newly diagnosed or in those shoes that's listening, just know that no matter what happens, like, you just got to take one day at a time, and always advocate for yourself too. And it's okay to feel all the emotions all at once, and leave some space to feel those emotions, because especially when it comes to melanoma, especially for women, I know a lot of women, because I've had conversations with them that were diagnosed around my age of their 20s. There is that a shame, or feeling shame and embarrassed, because they do feel like they kind of contributed to their cancer. And over time, I had to kind of work on that and reframe that way of thinking, because that type of thinking is not going to help you heal through your journey. But what can help you is knowing, in the past, I made these mistakes and made these choices that really weren't setting me up for success in protecting my largest organ. And unfortunately, I had to learn the hard way. But now, knowing what I know now and knowing what I've been through, I'm able to be here alive and have a second chance and take care of my largest organ. And if people feel comfortable to do so, they have an opportunity to share their story too. That's the thing I tell people. A lot of people say kind of what you shared with me is like, yes, I do really put a lot of what's happened to me online and on social media, but I do it because I'm trying to hopefully contribute to changing the statistics around melanoma and skin cancer for the better, because more and more people are getting diagnosed, more and more people are really not understanding the seriousness of it. And so if I can do my part and share my story and share kind of where I was and where I am now, that hopefully will inspire somebody. And so it takes time to process all of this and to really take your pain and turn it into purpose, but it is possible.
That's beautiful, because I do think people do get overwhelmed, to imagine, just getting a diagnosis of cancer, like you said, sort of how people simplified skin cancer and made it, oh, it just all is cut out and all is well. And obviously, all too well, that's not the truth. And we know that too, in dermatology, which is what we're trying to bring to the table for patients to understand the seriousness of it. But at the same point, like you said, not really beat yourself up. Like I tell my patients, I went tanning. And they're like, what? You went tanning? I said, oh yeah, that was the thing in college. It was the social event. Unfortunately, I didn't tan very well. So over time, I kind of didn't do it. But you went because that was sort of the group outing. And we went to lunch after, and it was a fun thing. But the risk really wasn't on our radar. It wasn't something we thought about. So to you can't really change the past, right? We've all made decisions or things we regret, or people we shouldn't have dated, or, the things we all make those choices, or we shouldn't have eaten that sundae last night. But at this point, I tell you have to kind of accept what is, right? And then to move forward, I think what you said is really poignant, really important for people to understand that you have to turn that, pain into purpose or process that. And you're right, dwelling on it is not going to help you move forward. In fact, it'll probably help keep you in the past, which you don't want to be. But I think after you get that diagnosis, you've gone through the treatment. I think what I wanted to have kind of your thoughts on, how do you deal with some of the emotion or maybe even the anxiety that comes with the diagnosis, and then trying to live your life, like trying to have, a life that you feel like is normal, like you like to run, you're going to be outside, right? Like, how did you cope with just adjusting your life to go back to your sense of norm and dealing with the sun and not fearing it? Because I do have some patients, and some of you out there might feel this way too. They've given up vacations with their grandchildren because they feel like they can't be out in the sun, or they've given up a hobby like you have because they feel like they have to live indoors. So how do you, think about that in terms of how you've dealt with this and really learned to live your life in a different way since your diagnosis?
Yeah, I think one of my biggest ways of moving forward after melanoma was not having melanoma dictate my future. And I really didn't want to sacrifice something like running that was such a big part of my life. And I really just had to learn, like we do for anything that happens in our life, change isn't always easy. And, if I wanted to continue to run outside, which is my preferred method of running, I don't love running on treadmills. I know everybody has their preference, but I always love to run outside. I knew I was going to have to make some different choices when it came to making sure I was wearing sunscreen, wearing enough sunscreen, wearing protective clothing, watching the peak UV ray hours, and maybe finding different routes for running that wasn't, totally always in the sun. And yes, was it challenging in the beginning? Yeah, because it was, back then, a couple years into or after my diagnosis, it was more like, oh, I have to do this, or, oh, this is frustrating. But at the end of the day, I tried to, again, it goes back to reframing your mind around it. And I'm not taking credit for this, but I've heard this on a podcast once. It's not, I have to do this, I get to do this. And, there's so many people that have had melanoma that are no longer here, that were my age, that had a very similar situation. It was just a matter of when they caught that melanoma. And the fact that I'm still here and I'm able to run, it's not that I have to run this way. It's I get to run this way. And that's a blessing and that's a gift. And did I think that the morning after my melanoma surgery? Absolutely not. I mean, that took me years. There are still moments when I get frustrated because at the end of the day, Dr. Trotter, we're human, right? I mean, things easily can frustrate us. But I think at the end of the day, when we take a step back and we look at what has happened to us, how we're able to reframe any situation into, something positive from it, we're able to move forward. And so to your question around anxiety is something I've dealt with even before melanoma. I am a big advocate for mental health and making sure that, we feel support in mental health and emotional health. I've been in therapy, and, I highly recommend it for everybody. But that is something that actually really helped me after my melanoma and moving forward, and kind of talking through, even as far as like why I even went to tanning beds and what that was connected to, being a woman, falling into societal beauty standards, not having a great self-image. I mean, that's a whole nother podcast episode, but it was important for me to kind of start at the root of that and then work my way forward. And, that helped a lot with anxiety, especially, post-diagnosis and going into skin checks after melanoma, which also would bring back the fear again of, is this going to happen again? Am I going to have another mole? Am I going to have another surgery? And the first couple of years was not easy. I mean, because as you know, Dr. Trotter, as a dermatologist, once you have melanoma, you're watched a little bit more differently than another, individual that's never had it. So any atypical mole, my derm was on it and biopsied it and, all that stuff. But every biopsy, it was like reliving that fear again and reliving that fear again. But I think I got to a point, Dr. Trotter, where I'd say I was at the probably 2.5 year mark where I had biopsies and they came back okay. that was kind of like the incentive of like, okay, so I can have something removed and things could be okay after that. And again, learning that, just because you have a biopsy doesn't mean it's going to be melanoma every time. That again has allowed me to heal and move forward and kind of, it's cliche, but time truly does heal, especially when it comes with the cancer diagnosis. No, the fear never completely 100% goes away. But again, like anything in life, as time goes on and you're able to manage those feelings and thoughts and reframe them, there's a path to move forward.
And it's a great message, I think, for patients to take, because when you get any type of, diagnosis that's just, devastating, for lack of a better word, it's how do you go forward? And I know people hate that old saying of, time heals wounds or heals all wounds. And I think, I hate to say it, but there's some truth to that. I think most people would argue that have been through a tough time, and not that it's the perfect solution, because it's part of the process and the journey and how you work through those feelings and emotions. That time comes with that, and that's how you kind of move to the next level. But we definitely have to applaud you for turning something that could be so negative in your life into something so positive, and a story that you've been able to share with so many people. And I know listeners out there have definitely felt what you felt, or they know somebody that has. So I appreciate you sharing that story. We're definitely going to have Leah on for a few more episodes here, because we're going to get perspectives on the experience she's had with her dad, prevention. So be sure to stay tuned for those. But Leah, for our listeners out there, if they want to try to find you online, social media, do you mind sharing where they can locate you?
Absolutely. The best place to find me is on Instagram. I'm at the Leah Alexis, all lowercase, and you can find out more about my journey there, follow along with all of my content about my story, my running journey, and also my dad's melanoma story.
Great. Thank you so much for coming on the podcast today. I really hope you guys enjoyed sort of this perspective. We're trying to bring about, for the healthcare providers out there, to help you remember what it's like to take care of patients. And that side we sometimes forget, because we do this every day. And for those of you out there that have had melanoma, been personally touched by it, I hope you've been inspired by Leah, like so many others have been. So thanks again, Leah, for coming on the podcast. I really appreciate it.
Thanks so much for having me, Dr. Trotter.
Sounds great. And stay tuned for the next episode of Derm-It Trotter, Don't Swear About Skincare.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermittrotter.com. Don't forget to subscribe, leave a review, and share this podcast with anyone who needs a little skincare sanity. Until next time, stay skin smart.